Experts from the Durban University of Technology say wastewater analysis shows that KwaZulu-Natal province is already experiencing the third wave of COVID-19 infections. They say the data shows the number of active cases in the province started to rise last month. Well, let's hear more about this. Let's talk to Professor Faisal Bucks from the DUT's Institute for Water and Wastewater Technology. Prof, good afternoon. Thank you very much for your time. Is it easy to track and trace whatever is the right word, the virus in water?
Thank you for the opportunity, and thank you very much. Yeah, that's a good question. You know, wastewater-based epidemiology is an emerging science, but it's been used quite a bit in many developed countries like the USA and Netherlands, many parts of Europe as well. So the background to the technology is where if a person is infected, they tend to shed the virus in their stool. And obviously the virus, the stool goes to a wastewater treatment plant. And that's where we can actually pick up the presence of the virus.
All right, so you did this study in and around eThekwini municipality, for example. What did you find?
So we've been working with one of the biggest plants in eThekwini called Central Works over the last 1 year. And surprisingly, you know, our counts over the last, viral loads over the last 1 month, I would say from the 30th of March, showed an increase. Yet the clinical testing showed an increase around the 20th of April. So one of the big advantages with wastewater-based monitoring is you can actually pick up the viral loads much earlier than when the clinical cases actually manifest themselves. So that's quite a big advantage. And the other issue we had was that surprisingly we found that the viral loads over the last 4 weeks was higher than what we picked up at the peak of the second wave around January this year for the Durban metro region. So that was cause of concern.
What does that tell us?
Well, it could possibly be that we are in the third wave. You know, generally when it comes to clinical testing, people only go for testing if they are symptomatic. They're displaying symptoms of COVID-19, not when they're asymptomatic. That's regardless in this technology, whereby even if you're asymptomatic, you're discharging the virus in your stool. And that's the advantage of the technology, because whether you're asymptomatic or symptomatic, you discharge the virus and we can effectively pick it up in the wastewater treatment plant. So it's a very powerful tool to monitor trends during the pandemic.
Now, we do have these scientists who are advising government through the National Coronavirus Command Council and various other forums about what to do and what to expect. Is your information, is your data being factored, considered when they make this decision? Because I think it's brilliant that through this system you get an early warning of sorts.
So I would say this is a trusted science. It's being used in many developed countries. We've just formed the KZN, COVID-19 Provincial Trust Team for using wastewater-based epidemiology. So at our last meeting, we shared the findings with the Provincial Department of Health. And obviously, it's up to them to now act on it.
Yeah, but you would be, of course, hoping that they will, because this is like, it sounds like brilliant. So are you currently, you yourself, you based in eThekwini, or are you currently the wastewater-based epidemiology, is it only being used there in KZN, around eThekwini in the country, as far as you know?
Well, nationally we have a network of teams that are working in the same field. It includes the NICD, the Medical Research Council, and other universities as well in the country. And we do meet regularly to share information. But when it comes to KZN and the eThekwini Metro, I would say we're doing most of the work in the field.
And this technology, can it be expanded to lower levels in the communities? Can you take it to district level, for example?
Absolutely. I mean, the one plant that we worked with covers 61 districts, the Central Wastewater Works. We can actually go down to pump stations. We can go all the way up the sewer network, right up to houses. So obviously, it will require much more resources, but that is possible. And as I mentioned, it's a very powerful tool, because it's not like you have to go and test every individual. Yeah, you're simply testing the wastewater and you get an inclusive finding of what the situation is within communities.
Yeah,
we're also possibly looking at non-sewage sanitation as well. to try and find whether the virus.
And for some reason, I'm stuck on the fact that it's like an early warning system. You can pick it up before people have got sick and they've gone to think. And also those who are walking around in our midst who are asymptomatic, they don't know that they've got the virus, but through the stools in the water, in the wastewater, you can pick it up. So can we say now for certain, in terms of the data that you've collected, just talk about eThekwini municipality and Saraz, can we say they are already experiencing the third wave of the coronavirus based on your data?
Sure. I mean, look, the medical experts and the relevant authorities have their own formula to make those announcements, whether we're in the third wave or not. But the kind of findings we've got over the last 1 month, I can say with a strong degree of certainty that we could be in the third wave. But I guess we leave it to the medical fraternity to announce on that, and the relevant authorities.
Okay. Professor Parks, thank you very much for your time and your insights around this technology that can stand us in good stead as a pre-warning at least, and a real test of what's going on out there when it comes to viral infection like the coronavirus in this case.